I am Dr. Laura Moreno, and in this video, I want to talk to you about tingling and numbness in the hands and feet, sensations that many people experience at some point and often ignore, minimize, or explain away. That pins and needles feeling, the numbness, the burning or slight electric sensation can seem harmless at first, especially when it comes and goes. But sometimes these sensations are the body's way of signaling that something deeper needs attention. Tingling and numbness are not diseases by themselves. They are symptoms, and symptoms are messages. The challenge is that these messages can come from many different places in the body, which is why they are so often misunderstood or dismissed as nothing serious. One of the most common causes is temporary nerve compression. Sitting or sleeping in an awkward position, crossing your legs for a long time, leaning on your elbow, or keeping your wrist bent can reduce blood flow or press on a nerve. When you move again, the tingling appears as the nerve wakes up. In these cases, the sensation usually fades quickly and doesn't leave lasting discomfort. But when tingling or numbness becomes frequent, persistent, or appears without an obvious trigger, it deserves closer attention. The nervous system is very sensitive, and small changes can produce noticeable sensations. Another very common cause is poor circulation. When blood flow to the hands or feet is reduced, nerves don't receive enough oxygen and nutrients, and this can lead to numbness, coldness, or tingling. Some people notice this more in cold environments or when they stay still for long periods. Others notice it when they elevate their legs or hands. Vitamin deficiencies are another frequent and often overlooked cause. Certain vitamins play a crucial role in nerve health. When levels are low, nerves may not function properly, leading to tingling, numbness, or burning sensations. These symptoms can develop slowly, making them easy to ignore at first. Blood sugar imbalances are also a major factor. Changes in glucose levels can affect nerves over time, especially in people with diabetes or prediabetes. Tingling or numbness in the feet is often one of the earliest signs of nerve involvement related to blood sugar issues. It may start subtly, appearing at night or after long periods of standing. Repetitive movements can also irritate nerves. Jobs or activities that involve repeated use of the hands, wrists, or feet can lead to nerve compression over time. Typing, using tools, prolonged standing, or repetitive motions can all contribute. At first, symptoms may appear only during or after the activity, but later they can become more constant. Another cause that many people don't consider is tension in the muscles of the neck, shoulders, or lower back. Tight muscles can compress nerves as they exit the spine, leading to tingling or numbness that travels down the arms or legs. This is often mistaken for a problem in the hands or feet themselves, when the origin is actually higher up. Anxiety and chronic stress can also play a role. When the nervous system is constantly activated, sensations can become amplified. Some people experience tingling during periods of intense anxiety, often accompanied by shallow breathing or muscle tension. While this can be frightening, it doesn't always mean there is nerve damage, but it does mean the nervous system is under strain. However, not all causes are benign. Persistent numbness, especially if it worsens over time, can be a warning sign of nerve damage or neurological conditions. This is where paying attention to patterns becomes crucial. One important warning sign is numbness or tingling that is constant and does not improve with movement or position changes. Another is weakness, such as dropping objects, difficulty walking, or trouble with fine motor tasks. These signs suggest that the nerve is not just irritated, but may be impaired. Asymmetry is another red flag. If tingling or numbness affects only one side of the body, especially suddenly, it should never be ignored. Sudden onset of numbness on one side of the face, arm, or leg is an emergency and requires immediate attention. Pain that accompanies tingling can also be significant. Burning, stabbing, or electric shock-like pain may indicate nerve irritation or damage rather than simple compression. Changes in skin color or temperature can offer clues. Pale, bluish, or unusually cold hands and feet may point toward circulation problems. Redness, warmth, or swelling can suggest inflammation or infection. Loss of sensation is another important signal. Not feeling heat, cold, or pain properly increases the risk of injuries, especially in the feet. This is something that should never be ignored, even if it doesn't hurt. The timing of symptoms also matters. Tingling that appears mainly at night, that wakes you from sleep, or that worsens when lying down can point toward specific nerve compression patterns. Tingling that worsens with activity may suggest overuse or mechanical causes. It's also important to consider the broader context. Recent infections, new medications, exposure to toxins, or changes in diet can all influence nerve function. Even dehydration can sometimes contribute to abnormal sensations. Many people delay seeking help because the symptoms are not painful, or because they come and go. But the nervous system often gives early, subtle warnings long before severe problems develop. Ignoring those early signals can allow reversible issues to progress. Listening to your body does not mean assuming the worst. It means noticing what is normal for you and what is not. A sensation that is new, persistent, or progressively worsening deserves attention even if it seems mild. Tingling and numbness are the body's way of asking for investigation, not panic. Understanding common causes helps reduce fear, but recognizing warning signs helps protect your health. And as you start paying closer attention to these sensations, you may begin to notice patterns in when they appear, how long they last, and what makes them better or worse, which can offer valuable clues about what your body is trying to tell you and help guide the next steps in understanding what's going on beneath the surface. And those patterns are often more informative than the sensation itself. For example, some people notice that tingling appears mainly after long periods of sitting, standing, or working in the same position. This often points toward mechanical causes, such as nerve compression or reduced circulation. In these cases, changing posture, taking breaks, or gently stretching can make a noticeable difference. Others notice that symptoms are worse at night. Tingling or numbness that becomes more noticeable when you lie down or that wakes you from sleep can suggest specific nerve issues, such as compression at the wrist or ankle or changes in blood flow when the body is at rest. Nighttime symptoms should not be ignored simply because they disappear during the day. There are also people who feel tingling mainly when they are stressed or anxious. During stress, breathing often becomes shallow, muscles tense up, and circulation shifts. This can lead to sensations in the hands, feet, lips, or face. While this does not usually mean nerve damage, it is still a signal that the nervous system is overloaded and needs regulation. Another important factor is duration. Tingling that lasts seconds or minutes and resolves completely is very different from tingling that lasts hours, days, or becomes constant. Duration tells you whether the body is dealing with a temporary disruption or something more persistent. Progression is also key. If the sensation is slowly spreading, becoming more intense, or involving larger areas over time, that is more concerning than a stable, unchanged symptom. The nervous system tends to show progression when something is affecting it at a deeper level. It's also important to notice whether numbness affects function. Difficulty buttoning clothes, writing, holding objects, or walking steadily are signs that nerves are not just sending abnormal sensations but are struggling to perform their normal role. Function always matters more than discomfort alone. Temperature sensitivity can be another clue. Some people with nerve involvement notice that they don't feel heat or cold properly. Others feel exaggerated responses, such as burning from mild warmth or pain from light touch. These changes suggest altered nerve signaling and should be evaluated. The feet deserve special attention. Many conditions that affect nerves show up first in the feet because the nerves there are the longest and most vulnerable. A sock-like pattern of numbness or tingling, especially if it moves upward over time, is a classic warning sign that should not be dismissed. Hands are also commonly affected, especially in people who use their hands repetitively. But when both hands and feet are involved, especially symmetrically, it often points toward a systemic cause rather than a local one. Systemic causes include metabolic issues, nutritional deficiencies, and chronic conditions that affect nerve health throughout the body. These causes often develop slowly, which is why early symptoms are easy to overlook. Another important red flag is sudden onset. Tingling or numbness that appears suddenly, especially if it affects one side of the body, is a medical emergency. This is particularly true if it comes with weakness, difficulty speaking, facial drooping, or vision changes. In these situations, time matters. Pain combined with numbness can also signal more serious nerve involvement. Sharp, shooting, or electric pain suggests irritation or damage rather than simple compression. Pain that worsens at night or interferes with sleep deserves attention. It's also important to consider age. While tingling can occur at any age, persistent symptoms in older adults deserve careful evaluation as the risk of underlying conditions increases over time. That doesn't mean younger people should ignore symptoms, but context always matters. Lifestyle factors play a role as well. Prolonged sitting, lack of movement, poor posture, and repetitive strain can all contribute. On the other hand, excessive exercise or pressure on certain areas can also irritate nerves. Hydration and nutrition are often overlooked. Nerves need adequate fluids and nutrients to function properly. Poor intake, restrictive diets, or absorption problems can quietly affect nerve health over time. Another aspect that often surprises people is how long nerves take to recover. Even when the cause is identified and addressed, sensations may take weeks or months to improve. Nerve healing is slow, which is why early detection is so valuable. Waiting until symptoms are severe can make recovery more difficult. Addressing issues when symptoms are mild often leads to better outcomes. Tingling and numbness are not meant to be endured indefinitely. They are not something you should simply get used to. They are messages that deserve interpretation. The goal is not to self-diagnose, but to recognize when something deserves attention. Being aware of common causes helps reduce unnecessary fear, while knowing warning signs helps prevent harmful delays. As you continue to observe your symptoms with curiosity rather than anxiety, you build a clearer picture of what your body is experiencing, and that awareness is often the first step toward finding the right support, making appropriate changes, and preventing small signals from becoming bigger problems over time. And once that awareness develops, many people begin to realize that tingling and numbness are rarely isolated events. They often connect to other subtle changes that seemed unrelated at first. Fatigue, changes in balance, muscle cramps, or even changes in mood can all be part of the same picture. The nervous system doesn't work in fragments. When one part is affected, others often respond as well. Another aspect that's easy to miss is how posture over long periods of time shapes nerve health. Modern life encourages long hours of sitting, looking down at screens, or holding the same position repeatedly. Over time, this can narrow spaces where nerves travel, especially in the neck, shoulders, lower back, wrists, and ankles. Tingling in the hands can originate from the neck. Tingling in the feet can originate from the lower back. Focusing only on where you feel the sensation can make you miss the real source. There's also the role of inflammation. Low-grade chronic inflammation can irritate nerves slowly and subtly. This doesn't usually cause sudden pain. Instead, it creates vague discomfort, sensitivity, or altered sensations that fluctuate. Because inflammation often doesn't feel dramatic, people live with it for years without realizing its impact. Sleep position matters more than most people realize. Sleeping with bent wrists, curled arms, or pressure on the legs can compress nerves for hours at a time. Waking up with numb hands or feet that resolve shortly after moving is often related to this. But when it happens every night, it's a sign that something in your setup needs adjustment. Footwear is another overlooked factor. Tight shoes, high heels, or footwear that compresses the toes can irritate nerves in the feet over time. This may show up as tingling, burning, or numbness that slowly becomes more persistent. The same applies to tools and devices. Holding phones, steering wheels, or tools for long periods without variation can strain nerves. The body tolerates repetition poorly when there is no recovery time. Hormonal changes can also influence nerve sensitivity. Some people notice changes in tingling or numbness during certain life stages or hormonal transitions. Hormones influence fluid balance, inflammation, and nerve signaling, which can all affect sensation. Another important piece is the immune system. In some cases, immune-related processes can affect nerves. These situations often involve progressive symptoms, spreading sensations, or weakness. While not common, they are important to recognize early because they require prompt evaluation. The emotional response to tingling and numbness is also worth mentioning. These sensations can create anxiety, especially when they are unfamiliar. Anxiety then increases muscle tension and nervous system activation, which can amplify symptoms. This feedback loop makes it difficult to tell what came first. Breaking that cycle often requires addressing both the physical and nervous system components. However, it's important not to dismiss physical symptoms as just anxiety without proper evaluation. Anxiety can amplify sensations, but it is not always the root cause. Another warning sign is when numbness affects coordination. Tripping more often, difficulty judging where your feet are, or clumsiness with your hands suggest that sensory feedback is impaired. These changes should never be ignored. Some people notice changes in reflexes, such as feeling less responsive or slower to react. While subtle, these changes can reflect nerve involvement. The timeline matters too. Sudden symptoms demand urgent attention. Gradual symptoms still deserve evaluation, but the approach may differ. Knowing the difference helps guide appropriate action. Tingling and numbness are not diagnoses. They are clues. And, like all clues, they make more sense when seen in context. Paying attention does not mean catastrophizing. It means staying curious, noticing trends, and being willing to seek guidance when something persists or progresses. The nervous system has an incredible ability to adapt and heal, but it also needs time, resources, and proper conditions. Ignoring early signals can overwhelm that capacity. When you respect these sensations as information rather than nuisances, you give yourself the opportunity to intervene early, adjust habits, and protect nerve health before more serious impairment develops. And that process of observing, adjusting, and responding thoughtfully helps turn confusing symptoms into meaningful feedback, guiding you toward choices that support your body more effectively and reduce the likelihood that these early warnings turn into long-term problems that are harder to reverse. And as that understanding deepens, it becomes clearer that nerve-related sensations are often the result of multiple small factors adding up over time, rather than one single dramatic cause. This is why so many people struggle to pinpoint when the problem really started. There is rarely a clear beginning. Instead, there is a gradual shift that only becomes noticeable once the body can no longer compensate. One of the most important things to recognize is that nerves need space, movement, and nourishment. When any of these are lacking for long periods, symptoms can appear. Sitting for hours without changing position, carrying tension in the shoulders or jaw, clenching muscles unconsciously, or staying in a constant state of alert all reduce the nervous system's ability to recover. Breathing patterns also matter. Shallow, rapid breathing reduces oxygen delivery and keeps the nervous system in a heightened state. Over time, this can increase sensitivity to bodily sensations, including tingling. Many people don't realize how much their breathing changes under stress and how that change affects their physical sensations. Another factor is blood vessel health. Nerves depend on tiny blood vessels to deliver oxygen and nutrients. Anything that affects vascular health can affect nerve function as well. This is why conditions that affect circulation often show up as numbness or tingling first in the hands and feet. Temperature regulation is another subtle clue. If your hands or feet are frequently cold, discolored, or slow to warm up, circulation may be part of the picture. These changes don't always cause pain, but they can contribute to altered sensations over time. It's also worth paying attention to symmetry. Symptoms that affect both sides of the body in a similar way often suggest a systemic issue. Symptoms that affect only one side may suggest a local nerve problem or something affecting the nervous system asymmetrically. This distinction can be very helpful when deciding how urgently to seek evaluation. Another warning sign is when numbness spreads beyond the original area. For example, tingling that starts in the toes and slowly moves up the feet or legs over months. This pattern should never be ignored, even if it is not painful. Pain is not required for a nerve problem to be significant. Some of the most concerning nerve issues are painless at first. The absence of pain can create a false sense of safety. Some people notice that their symptoms worsen with fatigue or illness. When the body is under strain, nerve function can temporarily worsen, revealing underlying vulnerabilities. This doesn't mean the situation is hopeless, but it does mean the system is under stress. Recovery also depends on reducing ongoing strain. Treating symptoms without changing contributing habits often leads to frustration. For example, addressing wrist tingling without adjusting repetitive hand use rarely leads to lasting improvement. Patience is essential. Nerves heal slowly. Improvement may come in waves rather than steadily. Some days feel better, others worse. This fluctuation is normal and does not mean you are going backward. Another important point is that not all numbness is complete loss of feeling. Partial numbness, altered sensation, or strange textures when touching objects can all indicate nerve involvement. These changes can be subtle but meaningful. There is also a strong connection between balance and sensation. The feet play a critical role in balance by sending constant information to the brain. When that input is altered, even slightly, balance can suffer. This is why paying attention to foot sensations is so important. Foot care becomes especially important when sensation is reduced. Small injuries may go unnoticed and worsen over time. This is not about fear, but about awareness and prevention. Many people hesitate to talk about these symptoms because they seem vague or hard to describe, but difficulty describing a symptom does not make it less real. Nerve sensations are often unusual and don't fit neat categories. Using clear language when you notice patterns can help. When did it start? Where exactly is it? What makes it better or worse? These observations are valuable. The body often communicates through discomfort before dysfunction. Tingling and numbness are examples of early communication. They are invitations to look closer, not reasons to panic. Ignoring them doesn't make them go away. Understanding them gives you options. And as you continue to notice how your body responds to movement, rest, stress, and recovery, you may begin to see how small adjustments can change these sensations, opening the door to better nerve health, improved comfort, and a deeper understanding of how your body signals when it needs attention, support, and a shift in how it is being used day after day. Subscribe to the channel and turn on the notification bell so you don't miss future videos where we explain health topics clearly and without unnecessary alarm. Share this video with someone who might find it helpful, leave your questions or experiences in the comments, and join me as we continue learning how to listen to the body, recognize warning signs early, and take better care of our health every day.